For this week, we wanted to do a video blog. This video blog is actually directly targeted at Tiger Woods, but it can help anyone else that's having a disc injury. So I wanted to let people know there are things you can do to give your disc a fighting chance to heal without having surgery. So normally what happens is when people get a disc injury, you have your bones in your back or your neck, and they're stacked up on each other. In between is the disc, and the disc is a really good shock absorber. It's able to handle force just like this. Over time, we put a lot of force into our spine, into our neck. We sit too much, we exercise too much, we do a lot of that. So what happens is it actually causes a lot of compressive forces that go through the spine, and it squeezes down on the disc. So if we cut your disc in half, what happens is it looks like this. It's got a toothpaste substance in the middle called the nucleus, and it's surrounded by these rings called the ligaments. And over time, your disc starts to slide and grind on itself. When your disc starts to slide and grind on yourself, it actually starts to get a little bit of tearing in there. And when you get that tearing, that nucleus actually seeps out, and that's what gives you that pain where people say, oh, I slept on it wrong, or I had this horrible pain and everything locked up. That's from the disc getting damaged. The problem with the disc is it doesn't ever give a chance to heal because a lot of people don't fix the problem that caused it in the first place. What causes the main problem is the muscles get overworked, and they develop what's called adhesion. Adhesion acts like glue that gets inside the muscle. All your muscles have to do is stretch and contract. When you get adhesion, it's like somebody poured glue in there. And what that does is it makes that muscle weaker and less flexible. The problem with adhesion is it just speeds up this degeneration. So you can't afford to have a disc problem and adhesion. It just makes it worse and worse. So in order to give this a chance, a fighting chance to heal up, you have to remove the adhesion. So think of your disc injury as your thumb and it's stuck in the car door. The car door is the adhesion. We can't give this a chance to heal until we remove the adhesion. So doctors like me that are trained in the integrative diagnosis system, we're able to get in there with our hands and an instrument and get rid of that adhesion for good. What that does is it takes the pressure off of this disc and gives it a fighting chance to decompress. So if you're dealing with a disc injury and it hasn't got any better, even if you've had surgery, there is hope for you. You can get in there and restore some of those muscles and range of motion and give this a chance to heal up. That's our blog for the week. We'll see you guys.